all, I'm Ariza, a licensed clinical social worker, your test prep guru, and your personal hype squad. With over a decade of experience, I've been helping future LCSWs and LMSWs crush their exam, and now is your turn. So this is your one-stop shop for the tools, the strategies, and the confidence you need to level up and pass the exam like a boss. So no stress, no overwhelm. Here, we just want to focus on results. So let's dive in. And today we're going to be talking about somatic disorders. Yes. Somatic disorders involve physical symptoms that cannot be fully explained by medical conditions. So these symptoms are real, but often they can interfere with your daily life. Somatization disorder, undifferentiated somatoform disorder, hypochondriacism, conversion disorder, and pain disorder. Those are just some of the types of somatic disorders. So is your girl gonna jump into them and tell you about them? Yes, I am. So hold on tight. Let's start out first with somatic symptom disorder, SSD. Now the symptoms here is that you have chronic physical symptoms like pain, fatigue, shortness of breath, and it is accompanied by excessive thoughts, feelings, and behaviors that are related to the symptoms. The characteristics here is that the symptoms can go from mild to really severe, and they can fluctuate over a period of time, and they are not deliberately produced. So it's not something deliberately that the person's doing or trying to have so they can complain and just say they have something going on. That's not how it works. So now somatization disorder, this is when you have multiple unexplained physical symptoms, including like gastro complaints, like your stomach cramping. You have pain symptoms like, oh, my back. Ooh, all those different kind of things. You can have some difficulty swallowing. You can have some sexual symptoms such as erectile dysfunction. All these are the types of things that someone can experience. And some of the characteristics here is that the symptoms typically begin before the age of 30 and they persist for several years. So it's not like they get it at 30 and then it's done after a few weeks. Normally it's an ongoing thing and it happens for a few years over a period of time. Now, the undifferentiated somatoform disorder is when you have one or more unexplained physical complaints, and they last for at least 6 months, often including like that chronic fatigue. And some characteristics here is that it's pretty common in young women and those in a low social economic status. You ask me why? I don't know. I'm just giving you the facts. I'm not sure why young women and those in a low socioeconomic status are more faced with this disorder, but that is what is shown statistically. But I'm sure if you pull out that DSM-5 and go in the section of cultural, can't think of the exact name of it, but it's a cultural section in the back, it kind of breaks down the different types of this that specific disorder and what you should likely see under what type of race, religion, well not religion, but race and ethnic group. Are you studying for the LCSW or LMSW exam? Don't waste time on the wrong prep. Try my test prep program for free with a full module that gives you the real strategies, the real practice, and real results. Plus, you get access to my exclusive test prep community where you'll find support, study material, and accountability. No risk, no stress, just results. Click the link in the bio so you can get ready to win with the winning team. So, as we move on, because I don't want to confuse you and get all tongue-tied on things that are not really relevant, let's talk about conversion disorder. I'm sure you guys have heard of conversion disorder. Conversion disorder or functional neurological symptom disorder. Yes. With this disorder, the symptoms are like weakness, paralysis, abnormal movements. They don't follow pretty much well-known neurologic pathways. It's just something that the person's experiencing. And normally these symptoms have a sudden onset and they can be triggered by some type of psychological stress. So if the person's under like a psychological stress, they might experience some symptoms of the conversion disorder. Treatment here for these different types of disorders, you got the CBT. Yes, CBT. That is an effective helping mechanism for patients to help cope with the symptoms and also to kind of help reduce some of the health anxiety that they're being faced with. Of course, you'll take some medications, some SSRIs and some SNRIs. Of course, you want to know the breakdown and want to know more about that, I do have another video on psychotropic medications. And of course, in my course, I'm breaking it down in either further detail. So let's talk a little bit more about these somatic disorders, what to expect, what to see, what you should know. In a nutshell, these are disorders in which a person is sharing that something's wrong, something is going on with their body physically, and there's no medical reason for it. So they might be going to the doctor and saying, oh my God, my shoulder's been hurting. They're doing x-rays, MRIs, and the whole nine. And they're like, ain't nothing going on with your damn shoulder. But the person feels otherwise. That is what someone with somatic disorder would be facing or dealing with. So this is really important to know, because you're going to have clients, you're going to have people you know in your life that are experiencing these things, and you don't want them to feel like they're going cuckoo for Cocoa Puffs, because they could be dealing with one of these somatic disorders. So it's really important to understand that this is a real deal. This is a real thing, and that it happens each and every day to the people we service and the people we care about and the people we want to help. So as a clinician, in this case, especially if you're working towards the LCSW exam, you need to know that this disorder exists, especially if you're going to be doing outpatient or working in any type of clinical setting. If you're working towards your LMSW, this is just good knowledge to have and to know. However, it's not something you're likely to see on the exam or really want to focus and delve a little bit deeper into, because it's not really going to be as relevant for the exam you're going to be taking, which is more like an application-based process. I hope this video was hella helpful. I kept it short, baby. This video was under 6 minutes. Your girl is breaking it down, giving you the juice and giving you the sauce in less than 10 minutes. So this is like a commercial break. You can watch your favorite show, turn on YouTube, watch me for a few minutes, pause it, watch the rest of your show, turn on YouTube, watch me for a few minutes, and in the middle of a show, you have watched a whole video on somatic disorders, and you're able to explain it to someone like a 5th grader, and they know everything there is about somatic disorders. That is what I hope you got out of this. So make sure you like, make sure you subscribe, make sure you tell a friend, because remember, on this channel, we're all trying to win. Be blessed until the next one.